Carpal tunnel syndrome, a common nerve entrapment that can affect work, sleep, and life. Good news? It's treatable. Let's break it down. For mild to moderate CTS, you can start with neutral wrist splints, especially at night. It's ideal for reversible cases like pregnancy or overuse and works even better when paired with other therapies. Cortisone shots, like a single methylprednisolone injection, can relieve symptoms for months. Symptom relief is on average about 3 months, and in some studies, approximately a third of patients can have long term resolution of their symptoms for single injections. And these patients do not require surgery. This how carpal tunnel injection is done: 45 degrees medial to the palmaris longus tendon. However, there's some risks to it, like medial nerve injury and tendon rupture. So to make this safer, you can do ultrasound guided cortisone shots. Oral prednisone, 20 milligrams a day for 10 to 14 days, offers short term relief, but it's less effective than injections itself. NSAIDs, diuretics, vitamin B6, and gabapentin are not recommended. They may ease musculoskeletal pain, but they don't target CTS itself. So for physical therapy, you can do a couple of things. Since the median nerves does run from the brachial plexus up to your palms, so first thing you can do is nerve glides. So you stretch out your arm just like this while stretching your neck in the opposite direction. And there are many variations of this you can do based on how comfortable you are. You can also do tendon glides like this. You can do wrist movements of whichever wrist is affected. And then you can also do shoulder and trunk rotations because this helps it mobilize also. When it comes to your lifestyle, small changes can make a big difference in how at risk you are for carpal tunnel syndrome. Pressure on the nerve within the carpal tunnel is increased with forceful gripping tasks. It would make sense to take breaks and do stretches when you need to use the hands for heavy gripping. When you're working or studying or whatever, you should always keep ergonomics in mind. For example, you shouldn't use a bad typing position like this. This could injure your carpal tunnel. Instead, use a better typing position, as you can see here. Healthy habits like eating healthy, biking, and jogging reduces your risk for carpal tunnel as well. Fix your wrist posture, take breaks, respect your hands. If symptoms persist after 6 weeks of treatment, or if there's thinner atrophy or nerve damage, surgery is the way. So you can do two types of surgeries. The first one is open carpal tunnel release. This is the traditional procedure to use to correct CTS. A surgeon makes an incision in your wrist and cuts the carpal tunnel ligament, the tissue that's hold the joints together, to enlarge the carpal tunnel. And the procedure is generally done under local anesthesia on outpatient basis. The other one is endoscopic carpal tunnel release. This involves the surgeon making one or two small incisions on your wrist and your palm. A camera attached to a tube is then inserted to look at the nerve, ligament, and tendons on a monitor. Using the image as a guide, the surgeon then cuts the carpal ligament with a small knife that's inserted through the tube. And this type of surgery can allow for faster recovery and less discomfort than traditional open release surgery. However, it also carries a higher risk of complications and the need for repeat surgery. If done correctly, it can have a 70 to 90% success rate. And post-operation splinting is not recommended because it can lead to more stiffness and adhesions. Endoscopic surgery allows faster return to work, often 8 days sooner than open release surgery. CTS, it's common, but it's manageable. Treat it early, treat it smart, and your hands will thank you.